Good morning, I'm Vic Senese, and this is UroNurse News. A new large-scale study has found that cannabis use may quadruple the risk of developing type 2 diabetes within just 5 years. Researchers analyzed electronic health records from more than 4 million adults across the United States and Europe. Of those, almost 97,000 people had documented cannabis use. Now, when compared to people with no substance use or chronic illnesses, cannabis users were found to be nearly 4 times more likely to develop diabetes during that 5-year follow-up period. 4 times. The study controlled for other risk factors like cholesterol levels, high blood pressure, alcohol, and cocaine use, as well as cardiovascular disease. Yet, the elevated risk in cannabis users remained. In raw numbers, about 2.2% of cannabis users develop diabetes compared to just 0.6% of the healthy comparison group. Now, let that sink in. Experts say the connection could be linked to insulin resistance and certain unhealthy dietary behaviors associated with cannabis use. Is that funny or medical talk for the munchies? Dr. Abraham Kamel of Boston Medical Center, the lead author of the study, says these findings highlight the need for greater metabolic monitoring and for healthcare providers to talk openly with patients about their cannabis use. Globally, cannabis use is on the rise, with an estimated 219 million people using the drug in 2021. As legalization expands and social acceptance grows, experts warn that hidden metabolic risk could have major public health consequences. Major. Now, it's important to note this was an observational study. It cannot prove that cannabis directly causes diabetes. The researchers caution that self-reported data, as well as incomplete information about cannabis types and dosages, may have influenced the results. Still, the message is clear. If you use cannabis, you may want to discuss your diabetes risk with your healthcare provider. And be mindful of your long-term metabolic health. Well, that's today's health update. For more stories like this, make sure to subscribe to UroNurse News on YouTube. Hey, tonight, perimenopause doesn't have to make you feel like a crisis. Tonight, Dr. Jeff talks with renowned expert Dr. Susan Kellogg-Spate to unpack hormone havoc, mood swings, and libido changes. Get the practical advice you need to understand your body and embrace midlife empowerment. Tune in tonight at 7 p.m. on drjeffsextalks.com. You don't want to miss it. In tomorrow's UroNurse News, I will share a powerful story of Jennifer Tsai, an emergency physician who chooses to introduce herself simply as Jenny. This episode dives into the bigger question of identity, hierarchy in healthcare, and what it really means to look like a doctor. It's more about that. It's more about than names. Thanks for watching UroNurse News. If you found this briefing helpful, don't forget to like, share, and subscribe. Hit those buttons, and we'll see you tomorrow.
From research to the latest views, it's UroNurse bringing news to you. With Vic Senese got in the way, UroNurse News every day. Na 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 na.